All right, good morning.
Good morning, Kathy.
Madam Chair and Commissioners, I think I'll start. I haven't been here for a couple weeks, so I'm not even sure what you guys have been doing. Okay, so we'll talk about the weekly cases, and you can see from the information in Clay County from the 30th through February 5th, that was 399 new cases, and now the preliminary number from the 6th through the 12th is 154. And as we talk about the preliminary number, it's just that there is no real-time data. It needs to catch up with all of the things that Minnesota Department of Health has to do with all the cases, and then to get it on the database and for us to see it. So 154 is the preliminary number, but still great because it's down. Minnesota, you can see from the 30th through the 5th, 23,234. And now it's 8,687. So although preliminary, it certainly appears that it's down significantly as well. In Cass County, we're seeing a decrease in cases from the 29th through the 4th. 1812 are the new cases, and the 5th through the 11th, 1,070 new cases. And in North Dakota as well, it's from the 29th through the 4th, 8,154, and the new cases now, the 5th through the 11th, is 4,643. So it's great that we're seeing a decline in those cases. Reinfection data, so Clay County is 837 reinfection, Minnesota 56,053, and in North Dakota it's 12,399. So again, the information there is if a person is counted as having a reinfection, if they test positive for COVID more than 90 days after the previous lab confirmed infection. So that's what we consider a reinfection. Weekly Clay County cases by date of test. So you can see the week beginning of October of 2021 is the initial number, and then it goes up to our data of 2/6. 2022. So we have that preliminary number again of 154, but you can see the real spike in January, and then now we're seeing the decline. So it seems promising to us that we're seeing the numbers going down. The weekly case count by date of test. So this graph shows from March of 2020 when we started the pandemic through January 15th of 2022. So again, you can see it really depicts the 4 waves, some of them certainly much shorter and less of an increase, but this last one, the huge spike, and now seeing the decline. So again, anticipating this is the decline of the 4th wave.
Kathy, briefly, if I look back on our weekly reports, it seems as though our new cases are below the threshold that they maybe were when we had kids going back to school last fall. Am I reading that correctly?
Do you know, Becky, do you remember?
I mean, just looking at that weekly Clay County case by date test graph.
Yeah, so again, the 154 reported for last week is preliminary. It's kind of hard to tell. We know that number will go up. It's hard to tell at this point how much. So I really would look back, I guess, to the week of January 30th where we're seeing that 399. So if you compare to the epi curve that shows the cases per week throughout the span of the pandemic, you can kind of look back and see where we are now compared to where we were in September. So, numbers were lower in September, I think, when school started compared to now. But, another week we'll have kind of a better idea of that.
But I think if, we try to find the silver lining in this, it does seem, and I know you've been hesitant to say that we're seeing a downward trend, but it seems like we are on a fairly good downside of this 4th wave.
Okay.
Just while we're
Commissioner
on,
Campbell.
yeah, thank you. Just while we're on that, so, and I don't have my last week's numbers, but how much did that 399? What did we report last week? That was three, it was still three something, wasn't it?
299. So it went up, yep, it went up about 100 after the data caught up.
Okay.
Yeah.
Okay, the cumulative cases by age, so we're seeing that we have 18,940 total cases, and this graphic is just breaking it out by age group. So you can see still the highest number being the 20 to 24 year old. You do this one?
I can do this.
Okay.
So here's the graphic that's put out by the CDC just to show the level of community transmission. So status quo, we're still at that high level of transmission as well as the rest of the state. This is our Clay County deaths per week, and so we did unfortunately have another death reported, so we're at a total of 118 deaths for Clay County throughout the pandemic. And this is Clay County new hospital admissions per week. So we had 7 new admissions reported so far for last week, with 11 admissions the week prior to that. So again, also seeing a promising trend downward with the number of people that are requiring hospitalizations. This is the hospital capacity information for our local healthcare systems. So at the time of this report, there were a total of 8 staffed adult ICU beds available in Fargo and 3 pediatric ICU beds available. Statewide in North Dakota, there was 20 available ICU beds for adults and 3 pediatric ICU beds available, which were all in Fargo.
Can I ask a quick question about
Commissioner Kaylee.
that? So with Essentia and Fargo, it says, not applicable. Does that mean that they don't have?
Correct.
So there just would not be a number to fill in there.
Correct, yes.
Thank you.
And then this is the COVID hospitalizations in North Dakota. So a total of 120 are currently hospitalized due to COVID. The number is down a little bit from last week when we reported 153 were in the hospital. There's currently 17 in the ICU, which is up a bit from last week when there was 15 in the ICU. There's currently 3 pediatric admissions. And then the graph on the right again just shows cumulative hospitalizations due to age, or broken down by age due to COVID. This is the vaccine breakthrough report that's put out by MDH. So again, just comparing side by side the information that we gave last week compared to this week. So we are seeing some increases in breakthrough infections as expected. So right now we're at 9.846% of those that have been fully vaccinated have wound up testing positive for COVID. Breakthrough hospitalizations and deaths still remain very low. We're not really seeing much movement in those percentages, which is a promising sign that this vaccine is really doing a very effective job at keeping people out of the hospital and getting serious illness.
Commissioner Ebinger.
Yeah, I read a report this week, and I believe it was a Moderna, that they had determined it started losing the boosters started losing efficacy 4 months, from 90% plus efficacy to 70% plus. Is there any thoughts in looking at how we gradually just get it's still a great result, but we're gradually getting a little more breakthrough. Is there any discussion on additional booster shots or annual boosters, something along that line? Is that in the works, or have you heard discussions on it?
I guess I haven't heard anything real specific. I don't know, Kathy, if you've been in discussions.
They've been talking about it, but there hasn't been anything definitive yet. But as far as the booster, they did shorten the time frame now. So it was 6 months and now it's 5 months. So I think in response to that, the leg in immunity, they're shortening the time frame for the booster dose, both Pfizer and Moderna.
Another booster would be available 5 months after the first booster?
No, this is just the regular booster, the primary series and then the regular booster. They shortened that time frame, so it's given a month earlier.
Okay, thank you.
And then this is just the graph that's also done by the Minnesota Department of Health, just showing the difference in the deaths that we're seeing due to COVID, comparing those that are fully vaccinated versus those that are not vaccinated. So the green line represents those that are fully vaccinated, so you can see a very low trend line, and then the blue line is those that are not vaccinated, and you can see there's a huge gap in the number of deaths that we're seeing. Jamie will talk about the vaccine data.
Okay, we'll look at the vaccine and testing next. So the first slide here, looking at the number of people with at least one dose. We are at 74.1% for those 5 and over across the state of Minnesota. And then 69.6%, so pushing 70% for those that have completed the series, and 2.1 million have received a booster or a third dose. And then we've talked a little bit about Clay County, so we're still sitting at about 60% in the data that they're sharing with us on the website for those that are 5 and over that are fully vaccinated in Clay County. And then we'll go to the next slide. And then looking at the vaccine administered by Clay County Public Health alone, 19,241 doses, and 99 of those doses were administered last week. We'll go to the next slide. And then for the week of February 7th through the 11th, we have a breakdown of the doses that were given. Of the 99, 72 of those, I mentioned we went to Concordia, we're invited there. 72 of those doses were administered at Concordia. And then also 27 of them at the Family Service Centers. So the majority of them, 87 of the 99, were the third doses or booster doses. Look at the clinic plan for this week. So this week we're offering Moderna and Pfizer. So the Moderna is, anyone 18 and over is eligible for a first, second, or a booster dose. Pfizer, anyone 12 or over is eligible for the first, second, and booster dose. And then we also have in the afternoon from 3 to 5, we're also offering the first and second doses, which is what's eligible, the 5 through 11-year-olds. So no booster eligible for that population. That's why we break it down that way. And then anyone basically looking for a booster is eligible in the afternoon as well. So those clinics are posted on our website. You can register for them. We are going to be in the public health office again because of our low numbers, but we have the ITV room available if we need to move back. We talked a little bit last week about the 6-month through the 4-year-olds, and that the FDA was going to be reviewing that today, I believe it was. And they did. Pfizer asked for an extension on that because they want to look at the third dose, basically, if there's a need for a third dose. So our kids, when they are eligible for a flu vaccine, that very first year, they don't just get 1 dose like the rest of us do, they get 2. So they're looking at, if they authorize the 2 right now, is that enough, or should they have 3 as the rest of the people are getting the 2 in that base? So that's what they're looking at, just looking at that data before they move forwards. And then looking at the testing, the next slide, the Vault testing site, the total doses or total tests have been 103,393 to date. Becky has this slide put together for us to look at the positivity rate, but we also have our data of the breakdown here. But it was January 2nd that we really saw, a spike, that we started to go in. The positivity rate was at 25.8. And then our peak was on January 16th, where we saw a positivity rate of 27.45. And now you can see we're trending down. So this past January 30th, we had a 19.08% positivity rate. So looking at the positivity rate and, watching this data, and then also our cases, really is showing us that what's going on in terms of the community spread. And so it's a good way for us to kind of measure not just statewide, but what's going on in our own community. So we're thankful for the opportunity of the Vault site that we have, even if our hours are not meeting our needs. We're thankful that they continue to serve us here. And then looking at our breakdown, last week we didn't have the breakdown of the positivity for the saliva testing and the rapid test. Saliva is the PCR test, which is the lab confirmed, and then the rapid test, you get your results right there. And the positivity rate for the saliva test for the week of January 30th was 24.05. And positivity for the rapid tests were 15.77. And then you can see the breakdown of the number of tests that we had. So there was 1,520 total tests that week of January 30th, and of those, 290 were positive. So looking up.
Okay. Questions? Questions? Commissioner Campbell?
Thank you. At what point, the discussion is always about now in terms of, for Clay County and our sites, is the mask issue. At what point was it that we reinstated that?
When, I'm sorry if I'm jumping ahead of you, when, at the end of December, this board made a motion to end our masking policy. And at that time, the active cases in Minnesota was 26,106. And our weekly new cases were 325. 2 weeks later, as you can see in the maps, we saw the trends, and then there was a motion to reinstate the policy, but that's the threshold that we had removed them last time.
But just a slight correction. I think when we didn't remove the mask policy entirely.
In December, we did. 2 weeks later, we reinstated it.
But there was still a policy about, even then, even though,
If you're unvaccinated.
if you're unvaccinated, we still had a policy that basically followed CDC guidelines in terms of, so there still was a policy there, but it wasn't a mandatory everybody wear masks going into our facilities. And I guess I'm at the point where it's my understanding that effective yesterday, all of them were at schools no longer require masks. Is that correct?
Yes, the last elementary schools were removed yesterday.
I see these trends. The positivity rate is still a little concerning to me, but we don't have the data. The last data we have is January 30th, and it's those last 2 weeks that we really have seen the drop, But and I know Kathy, back when we reinstated it, it was your recommendation that was the reason that I supported putting the mask mandate back on. And I don't want to put pressure on you, but I'm just wondering, at some point in time, we need to keep reviewing this, and we said all along that we would review it. And if we're getting close to numbers that we were at before, and we felt comfortable not having that policy in place, are we getting close to that again now?
Yeah, Madam Chair and Commissioner Campbell, we actually were reviewing all that. The CDC, of course, isn't changing their masking guidance, but they're covering the whole U.S., and there's areas in the United States that the numbers aren't going down. They're not trending down. So they really can't generally say that we can end the mask mandate. There's also people that are still unvaccinated, and we'll always have those individuals. What the national experts are saying is really becomes local. So what's happening locally in your community, and that's where it should be, because all the communities are really trending differently. So we're optimistic. As you saw, the numbers are going down, our positivity rate's going down. We don't anticipate, one national expert thinks we're on the downward trend, even across the whole U.S. That's, again, a prediction based on the data that he's seeing. So I'm optimistic that we're in the right direction, that we're in a downward trend. So it's certainly the opportunity to, do we need to have a mask mandate? There's many states that are ending their mask mandates, just like the schools. So it's certainly the time to say it's optional. I'm not hard and set on we have to continue. The thing is, if we see a spike, then we change course again.
I don't mean to put the political pressure on you to make that decision. That is our job, to do that. But what I do and what my vote is dependent on is your professional opinion. And that's what I'm looking for. And if you're, if you're comfortable in that, then that's good for me. But again, each of us have to make that decision as a policy, so.
Yeah, Madam Chair and Commissioner Campbell, I think, as we look at the numbers, they're clearly, even across the river in Cass County, they're trending down. As we talked with the hospital CMOs just a day or two ago, they're optimistic about the cases, not seeing, they're trending down. The number of staff they have that have been out with COVID-related illness is minimal now. It's very manageable. They're managing their beds. They're managing the numbers that they're seeing in COVID, so they're really feeling comfortable with those numbers. The acuity of other cases that are non-COVID are really keeping them busy. So it's the non-COVID acute medical cases. So, based on what we're hearing from CMOs, based on our data, kind of speaks for what's happening locally, so.
I have a question for
Commissioner
Darren. Do we have a lot of employees out with COVID? What's our count?
Not right now. We haven't gotten a lot of forms back that people were out right now. Back when we peaked several weeks ago, we had fairly a lot of employees out. But as of right now, I don't think I've received a form for probably a week and a half, maybe 2 weeks.
Thank you.
Commissioner Campbell?
Yeah, I notice a lot of our county employees out and about, and it seems like the only place that I'm seeing them wear masks is here, and it's because we make them, and I guess I'm as confident I was in putting the mask mandate on. I think it's time that we look at going back to where we were prior to this, where we still have a strong recommendation to wear them, and especially if you're not vaccinated. And I think we had the appropriate signage, didn't we?
Yes.
Mark, Mark is head nodding yes, that we did in that regard. So I think we're moving in that right direction. And I would move that we go back to the previous policy.
Okay, we have a motion by Commissioner Campbell to revert to our policy earlier, which was a strong recommendation and a requirement for those who are unvaccinated. Signage could happen.
Again, last time it was, I moved to put the mask on effective the next day, and I would say effective tomorrow.
Okay.
Would be my
And,
motion.
We have a motion by Commissioner Campbell and a second by Commissioner Gross. Do you have comments? Commissioner Kaylee.
Kathy, last night you had a date with the city council. Thank you for spending your Valentine's evening talking to more officials about these things and answering questions. And I did watch that portion, and I noticed that the preliminary number that you shared for case counts last night was 66. And then this morning, that number has been updated, and it went up to 154. So in just a couple days, that more than doubled. And then when I look back at last week's numbers, we went up another 100 from that preliminary number, but that also is still scaling back the next several weeks as well. So the number that had been reported for the 23rd at 680 has now gone up to 905. So it's hard to make choices based on these numbers when 2 weeks later, they're still increasing substantially. I feel like it's not time yet. We could slow our roll a little bit. and wait a couple weeks, see what happens. I agree, yes, absolutely. It looks like we are on a downturn, but that doesn't mean that it's gone. It's still here. There's still a lot of cases in the community. The positivity rate is still really high at that vault testing site. So I would just urge that we slow our roll and pause.
Thank you for those comments, Commissioner Kaylee. Just,
Can I just,
Kaylee.
yeah,
Or Campbell.
thank, just, I just want to comment on the new cases and, you know, granted, I'll even add another 100 like it was done the previous week to 154, that would put us 200. That's 254 in a week's time of new cases, right? That's not a daily average.
Correct.
That's in a week's time. We were at one point in time, we were looking at, what, how many new cases per day? We were looking at potentially 300 new cases a day. And now we're down to, you know, if you look at this, we're probably down to more like 40 or 50 new cases per day on average. That's throughout the county with 65,000 people. So I guess that's, to me, I think that's a pretty small number
Thank you.
in comparison. I mean, everyone is important. Every case is important.
Thank you. And I think as this board tries to find some sort of consistency in what our policy is in regards to managing masking policies on the, I think it's important that we stay as consistent as possible. I think it's helpful for our credibility. I think our message all along is to continue to practice good hygiene and get vaccinated and mask when you can, if you feel comfortable with that. But I think if we look back at when this board did make a motion to get rid of the mask mandate, the state counts were 26,106. The state of Minnesota active cases right now is 8,687, and we're below the threshold for new counts on a weekly basis. I still think that we have a lot to learn in how this virus continues to live and grow, but I think we have to figure out what is our new normal living with infectious diseases. I think that's what all states and municipalities are trying to figure out right now too.
How many of these cases, do we know that they're not just the flu or that they're COVID? I mean, is that pretty well diagnosed that this one's flu, this one's COVID?
Yep. Madam Chair and Commissioner Gross, yes. They, all the cases we know that they've been tested specifically for COVID. Influenza is around, and there's a number of cases circulating with influenza. That's a separate test. So in some cases, if someone is quite ill, they'll test them for both influenza and COVID, two separate tests. So yeah, it's clearly defined. And Madam Chair, the one thing to mention is, as Jamie reported, the statewide vaccination rates. So 70% was also a target, and we're at that 70% with the one dose, just 1% under with the 68 or 69%. So we're right at that threshold where that's also a marker. 70% was the target where we're feeling pretty confident about people getting vaccinated. Although Clay County doesn't show that, we've reported it weekly that we know our numbers aren't accurate because people, you know, there's some things that don't come on the registry, so we can't track all of the people that were vaccinated when they've been to pharmacies and other facilities. So we're pretty confident that our numbers in Clay County mirror what the state.
Commissioner Campbell and then Commissioner Kaylee.
Yeah, I just want to point out that Commissioner Mosier mentioned something to me that is significant, and that is the fact that we need to be consistent with our policies. And we had policies when we took things off and when we put things on. And now we're in a position, we're at a point where it matches where we didn't have to have the policy. And so for us to say now we should have the policy now, but we didn't have it back then when the numbers were the same, especially when everything is showing a decline. Now, if if you'd come to us this week and said, well, that decline is leveled off even, I would have my concerns about making the motion that I made today. But based on what I am seeing and hearing in these numbers, it goes back to where we were before this, and I just think we need to move forward on this. And like I said, I think we're gonna have this conversation for the rest of our lives in terms of
Commissioner,
this pandemic. Hopefully, pretty soon you're gonna just say it's an endemic and we're gonna move on.
Commissioner Kaylee.
Thank you, and I certainly understand that consistency piece. My concern is that I don't feel like it's an it is an apples oranges comparison, because with the prevalence of at-home testing right now, we're not getting those cases reported unless they then go in and have another lab-confirmed case with a provider. My question is, I know that there's a lot of testing going on at our schools right now. Are those cases being reported to the state, or is that kind of like an at-home test where we don't get that data?
Commissioner Mojo, those are reported to the state. They're required to report them to the state, as well as our long-term care facilities that are testing.
Okay.
Okay, Commissioner Gross.
Okay, now, I realize now that we can all order our home test case, you know. I just got notice mine's coming in a couple of days, whatever. I mean, those wouldn't be reported either if you take a test at home, is it? You have to, if I take a test at home, is there a need for me to report it somewhere, or?
That I don't know, what that process is done, you know, how that works, if they actually are connected to watch you do it or not. I don't know about that. I haven't received mine yet.
I think there's both. There's some that you need to connect through the app, take the test with a proxy. There's also tests that you're taking on your own, which I think Commissioner Kaylee had referenced. I think it's all part of it. I think, just to add maybe some points is, I know several people who took the at-home tests that were provided by the school, and some members of the family had received a positive in one of that. They picked up everybody, went to the testing site to test. I think that it's hard to understand 100% of the data when some people are going through the line, maybe get a positive or not in the rapid, and then decide to go to the other test. We're not getting unduplicated information. So I think there is part of a very valid point that there are tests and maybe positives happening at home. We're not seeing that. There's the other part of it where people are receiving positives at home, want to go in, be tested so that they can make sure that it's being reported, but also that there are contact tracing that is happening. I think there's a lot of different avenues.
Yeah.
And, for me, what's important is that our hospital system is not overloaded. And I've said that all along. If you came to me and said Sanford had 0 beds, that's an indicator. And we are seeing a release in what that stranglehold was for available beds. There are more available beds that we had seen earlier. And, none of us have the crystal ball. I mean, that's the reality. None of us knew 2 years ago what this would end up happening. We continue to need to do our best on campus to make sure that we're hearing departments' concerns, but I'm not hearing concerns from employees or even the public about the practices at the county courthouse. Commissioner Ebinger has not spoken then.
We eliminated the mask requirements on our campuses, or our campus and our properties, and then 2 weeks later, we were back there. And I know it was because Omicron came on so fast, so hard. I think we need consistency, but I don't think there's a artificial line out there. I think we need to make sure that the downward trend is going to continue. Another week, another 2 weeks. Not speculate on what these numbers that we know are incomplete, and it's not through our public health people's fault. There's a lag in the data. And I would just feel better before we do something, even though it's only a minor precaution, taking care of the people that come to our campuses and to work on our campus. I want to give it a couple more weeks and see if we see a pattern established that gives us, not make the mistake we made before. There may be something else around the corner. Let's make sure that what we're seeing in this trend reaches the point to where we're comfortable that we've made it through. There may be another variant out there at some point, and we'll be, if we drop it in 2 weeks, we'll be right back to doing it in a couple of weeks after that. But at least at that point, we'll know more of what we're dealing with. There's too much unknown here for me to feel comfortable taking anything backward.
Thank you. Commissioner Campbell?
Yeah, I want to go back to the at-home tests, and I know Commissioner Cayley brought that up, and it is a good point, but I also know that I have personally talked with many people who've taken the at-home tests and they've been negative. And those have also never been reported as part of the process. So that could also have an impact on the positivity rate that aren't reported. So you can, again, it's how you can look at it either way. But I know in my family, I've had a lot of family members that were concerned about, because they were around COVID. And they all took the tests and they were all negative. And as a matter of fact, they did it more than once and they were negative. So, and then I just going to Commissioner Ebinger, I don't think we made a mistake the last time we took the mask mandate off. I think we did it based on the numbers that were present at the time. And I'm not going to be afraid to put it back. For us to do this, it's a board vote, and it's a matter of a little bit of work on Mark's part or whatever, that we go in and we just put the signs back up again on the next day and it's done. But this is something that, and again, I'm seeing and I'm visiting with county employees who are, they're comfortable with it off. And that's why I'm supporting it, so.
Okay, any comments? Any other comments? We do have a motion and a second on the table. Any other comments? Colleen, can we have a roll call, please? Sorry.
No.
Yes.
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 No.
Okay, thank you. We do have a 3-2 vote, but the motion will pass effective in the morning, if that works in terms of signage. I do have one follow-up regarding the vault testing site. Certainly, I saw another article that our calls for increased and more convenient timing is continuing to go unheard. What is the messaging you're hearing from the state in regards to the community testing sites? It seems like their messaging is really to encourage more at-home testing. Are we confident that that site will stay open for a while now, or what are we hearing?
Yeah, Madam Chair, we're hearing that they said the spring, that they would be open till the spring. So what month that will be, I'm not sure. They haven't confirmed that. Yes, we did hear that they didn't feel the need to expand the hours, open them up earlier in the morning, and they didn't feel a need to add any additional days. So we got, that was kind of the answer. We did get some test kits that we got out to some populations that may be hard to reach. So our new individual that we hired as variable hour for the diversity and inclusion got test kits out to many of the organizations that serve populations of diversity. So that was good. We got those test kits out a couple weeks ago. We're getting masks out to those individuals as well and to the general population. I think we got 10,000 masks. So it was quite a percentage of masks that we got what we requested. They only had 70,000 throughout the whole state. So we're getting those out with that person that we hired as well. So we're meeting a lot of the testing needs and masking needs. So, I mean, that's good. I think the vault site will obviously continue for at least a couple more months, maybe a few more months. We haven't heard about any closure date.
And I think the other piece is that the messaging from MDH and the governor's office seems to encourage folks utilizing those testing sites being people that are showing clinical symptoms of COVID, maybe not as a mitigation tool. Certainly, I tested myself this morning with a rapid test at home, and so I think they're encouraging people to, if you want to just make sure that you're clear for your workplace, to order those tests online and do that at home.
Yeah.
Commissioner Campbell.
Yeah, thank you. I just want to remind folks, so what we did today is we still are, we're highly recommending masks.
Yes.
Especially if you haven't been vaccinated, going into our county facilities. This last week, I had a physical at Sanford in Moorhead, and I went in wearing a cloth mask like this. And they had me change my mask. And the reason they did it is they probably felt that it maybe wasn't as protective as another type of mask was. So there's a lot of things, even wearing masks, that, you know, there's some unknown, you know, how you wear them, how tight they are, and all those types of things also can come into play. And so, I mean, that's the science of it. I guess that's frustrating, but.
And Madam
you.
Chair and Commissioner Campbell, that's true, the masks, there's lots of information about the cloth versus the other ones, and the N95s. The N95s or KN95s are very difficult to wear for a full day. They just are, because they're very tight-fitting and they're hard to wear. So one of the national infectious disease experts said it's probably impossible to think the general population is going to wear an N95 for a full day. You can maybe get by when you're in the medical healthcare system because you have to, but just for the general population, it sure is the best mask, but we can't expect that the general population is going to be able to wear that.
So, and we're still expecting the social distancing and all those
Correct.
things that we've all done, and all part of the process to slow the spread down, and none of that's going away.
And
within
Commissioner
our policy.
Campbell and
All of
Madam-
those things are still recommended.
Yep. And the one more thing is, when you mentioned the unvaccinated, we also want people that have underlying health conditions to be extra careful as well. So still continue to mask and do all of those things, because it's those individuals that also are at risk for, significant illness.
Anything else? Thank you. We
Thank
appreciate
you.
it. Thank you for your work, and we'll look forward to meeting your new hire next week.
Okay.
Thank you.